Hey guys, so the video we're going to go over today are going to be for some exercises to get better dissociation for the pelvis and for the hips. We've been getting a lot of runners in recently and triathletes for that matter with a lot of hip pain, low back pain, even knee and ankle issues. So we've started a few of them on some exercises to help to get better dissociation between the pelvis and the hips. So with exercises particularly for running, we have to have good hip internal rotation, external rotation, as well as having a good stable femur and allowing the pelvis to be able to rotate internally and externally around that femur. So what we're going to go over a couple exercises that we use to help implement the feel for that kind of movement happening in those joints. So we use some DNS positions for that. So one is going to be a low oblique sit, so we can get them to get some good activation in the glutes and in the pelvic and hip rotators as well. So what that's going to look like is we get them down on their side. Their points of stability are going to be the elbow, and for starters, the outside of the hip. So they would come down onto the side just like so. So the dissociation happens in the joint on the bottom. What it's going to feel like is, again, my pressure is going to be on the outside of my hip. But what I'm going to do is I'm going to rotate my pelvis around that femur. And as I complete that rotation, the rotation itself will cause my hip to then start to lift up. And from here in this position, if we have everything aligned properly and my stability points are good in my shoulder, I'll definitely feel a burn on the outside of my hip there, getting that glute med to fire, and then I'll come down and then we'll get them to rotate back again. So my points of stability are back on my hip now. And as I'm rotating forward, my pressure is now transitioning down the outside of my thigh towards my knee. And if I still complete that rotation, then again, my pelvis and my hips elevate and I feel a good burn in the glute. Another exercise that we show is a standing exercise. So they can feel foot and ankle placement, knee placement, hip placement, and then again how that pelvis is going to rotate around there. So what that exercise is going to look like, we get them lined up first, and they're going to get their back leg, their big toe is going to be in line with the heel. And what they're going to do, get everything stacked over top. And again, if we're looking at that little crease right there between the pelvis and the hip, what I'm going to do is I'm going to rotate my pelvis internally around that femur, externally around that femur, and we're just going to groove this position here so that they can feel that while everything's staying stacked and aligned over top of each other, I'm maintaining a good tripod in my foot at the same time as I rotate around, and I make sure that everything stays centralized and all that's moving is my pelvis around my femur. Okay? So those are the exercises. Those are what we've been using for some of the runners that have been coming in here based on some of the gait analysis that we've done with them, and it seems to be helping a lot, and people are getting back out there running and training a lot sooner than usual. So hope you guys enjoy. Bye.